Hello everybody, this is Dr. Ramy Fahim from Ankle and Foot Care Centers. We're here to discuss a very important condition that we treat in our practice, and that would be treating ingrown nails. So first thing we need to address is, what are ingrown nails? Ingrown nails essentially are conditions where and usually we see this in the great toenail, but it can exist in the other toes as well. But usually, for the sake of our conversation here or discussion, we'll say that it's a big toenail, and usually involves the incurvating, meaning having the nail growing inside the corners of the toe. This essentially would cause a lot of swelling, pain, in some cases infections, and drainage. So I'm here to talk with you about three big facts about ingrown nails that most people don't know. Number one, ingrown nails can come with MRSA infections, MRSA, which are methicillin-resistant Staph aureus infections. This is a very highly resistant strain. Number two, infections could be severe enough where you could actually end up with bone infections. And not just bone infections, you could also have infections severe enough where it could be traveling in the bloodstream and cause what we call bacteremia, meaning infection, bacteria in the blood. And this could lead to a condition, a very serious and life-threatening condition called sepsis. Finally, neglected ingrown nails can cause chronic pain as well too. So how do we treat those ingrown nails? Well, the key element here is understanding, recognizing that the position of the nail is abnormal. It's growing inside the corner. So how do we do this is essentially a little procedure that we do in the office, typically done in the office, in some cases in a surgery center if patients are sensitive to local anesthetics. But I would anesthetize the toe and essentially remove the ingrown corner of the nail all the way to its roots. And what do we do after that is kill the root of the nail with, and the root of the nail is called the matrix cells. We kill the matrix cells with chemicals to prevent regrowth of the ingrown nail. Usually patients are on antibiotics for about 7 to 10 days after this procedure. Involves post-operative care such as soaking and ensuring that the nail stays clean, the remaining portion of the nail stays clean. Patients tend to do pretty well with that, and the key component here is addressing the infection and potential for further infections. Big thing that I want to discuss with you also is, how do we prevent ingrown nails from coming back? Big misconception or big mistake that we always do is, when we trim our own toenails, we tend to trim into the corners and cut them too short. I always tell my patients, do not trim into the corners and do not cut them too short. That's the best way you could prevent an ingrown nail from happening.